The issue of racial disparities is so important because it really is a matter of life and death. It's a matter of quality of life for people of color. When you look at the fact that African Americans live shorter lives, shorter lifespans, when you look at the fact that the infant mortality rate is twice that of white babies, it really is a matter of life and death. We have to begin to close some of these disparities, and I call them, especially in healthcare, moral gaps, because that's exactly what they are. Here in America, the richest and most powerful country in the world, healthcare should be a right, not a privilege, which it has been. People don't understand how stress, first of all, affects one's life and how the social determinants affect one's health, such as poverty, race, unemployment, mental health issues. All of that impacts one's health. And when you look at the suicide rates, the alcoholism rates, the drug rates, HIV/AIDS rates, when you look at all of those disproportionate numbers in the African American community, those are clearly some racial disparities and some ethnic disparities that have to be addressed. And then when you look at the lack of services and the lack of care and health care, and the fact that we have very few community clinics and we have very few places for people to go, then you see those gaps there. You see lack of services, no insurance, sick people, sick communities. What do you have but a big gap that has to be filled? When you look at the HIV/AIDS rates, for example, young gay black men, African American women, the numbers are off the scale. We have to do something. We're developing a national AIDS strategy now to address this, but when you look at what has happened in the black community as it relates to diabetes, prostate cancer, when you look at HIV and AIDS, when you look at all of the diseases, they disproportionately affect African Americans. So our communities aren't as healthy as they should be because our people aren't as healthy as we should be. That means our young people aren't as healthy, and what kind of lives are they going to lead if in fact they grow up with diabetes at such an early age, and if they grow up in communities where there's no fresh fruits and vegetables and have to grow up eating junk food at schools. I mean, what kind of a life is that? What kind of a future is that? So it's a very serious issue.